Hi, I'm Dr. Sam Forlenza. I wanted to take a moment and talk to you about some information that I was researching and happened to come across. And I want to talk about a little bit about some causes from neuropathy, and then how right here in our office we go about treating those causes. And the most simplest explanation that I can give about neuropathy is, sometimes during our life, we may have been exposed to a trauma, or maybe some neurotoxins, or something in the environment that actually shut down some of our nerves. And then when that event passed, our nerves did not return back to their normal status. And some of those things could be caused by a lack of oxygen, such as when we deal with sleep apnea, or maybe even lung problems. We all know that neuropathy is many times caused secondary from diabetes. Okay. Chemotherapy treatment will cause secondary neuropathy. One part or phase of our treatment here is actually was and still is used in the cancer centers of America to help stimulate nerves. We found that chemotherapy deadens these nerve impulses, and hence neuropathy is formed. Trauma. Maybe you have fallen or involved in some type of accident. Impingement to your nerves. This could be, a lot of times, football players during their early careers, or other sports players, have this constant contact and actually shift the vertebra and will slightly shift it and pinch on these nerves. Environmental exposures to neurotoxins, pest chemicals, aspartame that we actually drink in some of these soft drinks. And even now, there's some related research indicating that some of these medications that were taken, such as blood pressure medication, cholesterol, these statin drugs, the research is now possibly indicating that this is a cause of what we call idiopathic neuropathy. You've done all these other tests and you just don't know why or how come you have these symptoms. You don't have diabetes, you didn't go through any chemotherapy, but yet you're experiencing neuropathy symptoms. And the research is starting to show that some of these statin drugs and blood pressure drugs could be actually the cause of it. And there's other reasons too, maybe post-surgery. There's a lot of causes. The best way that I can try to relate to you is maybe some point when you were younger, you sat on your legs incorrectly and your feet went asleep, or your legs went asleep. What did you do? Well, you just got up and you started bouncing and shuffling your feet and trying to get the feeling back. Okay, that's similar to what neuropathy is your nerves have went asleep. And right here in our office is we have technology that helps stimulate those nerves again. And what it does is just like you stomping on your feet, you caused a larger normal impulse to go to your brain to override that sleeplessness, that sleepy feeling, or those pins and needle feelings that you're experiencing in your legs and feet when you were younger, when your feet went to sleep. Okay? And that's what our technology does here. It'll send a larger normal nerve impulse to the brain to start bringing back the feeling of these nerves. And we have a lot of success with it. Anyway, I just thought that was interesting, and I want to bring it to my patients and viewers. If you have questions, we offer a free neuropathy consultation. We'll evaluate the neuropathy severity, the sensation severity that you have. Give us a call. Our phone number is right here on the bottom of the screen. And by always, ask for me. I'm Dr. Sam Forlenza. I'll be happy to call you back if I'm tied up with some patients to get your questions answered. Have a great day.